Hello, everyone, and welcome to this week's edition of Ask the Expert. My name is Ashley Baldwin from the Department of Communications at the Pan American Health Organization headquarters based in Washington, D.C. And we're here to talk about contact tracing and particularly the experience of the Bahamas in implementing contact tracing. So there's been a lot of talk since the beginning of the pandemic about testing, contact tracing, and quarantine as the most important ways of halting transmission of COVID-19. But when it comes to contact tracing, what exactly is it? Why is it so important? And how are countries doing it? We're joined here today by three colleagues from the Ministry of Health of the Bahamas. First of all, Dr. Blair Woodside from the Surveillance Unit. Hello, Dr. Blair.
Hello.
We're also joined by Nurse Ernestine Flowers, also from the Surveillance Unit. Hi, Ernestine. And we're joined by Nurse Chesmond Finley, who also works at the Surveillance Unit of the Ministry of Health. So welcome our special guests.
Good evening.
And last but not least, we also have from the Pan American Health Organization, Dr. Andrea Vicari, who's advisor for epidemic-prone diseases epidemiology. Hi, Andrea, how are you?
Hello, Ashley. Thank you so much. And apologies that I won't have as a nice accent as you have.
Oh, thank you. So, first and foremost, let's just kick off this conversation. What exactly is contact tracing?
If I may start, probably, Ashley, I would like just to say that it's not something new. Okay, it's really has been really a tool that we have had in terms of control of outbreaks for many years, and as epidemiologists, we are really used to use it. I guess that the challenge within the COVID-19 pandemic is really the scale that we need to do contact tracing. So really in what we do normally, really in terms of the follow-up of any case of an outbreak, is really on outbreak of a communicable disease, is really that we try always to find a case, patient, essentially, people that are sick. And of course, in this case, what is as well very important, as it may be with other diseases, is that we put this patient isolation. It means that, we try to avoid really that a patient, when the person is infectious, can really transmit the disease. But with contact tracing, what we are really trying to do as well is to find the contacts of this person, okay, what is essentially contact tracing, but it's not an end in itself. It is really that so that we can put these people that are exposed, may be as well infected, may develop as well the disease, but put them in quarantine so that really we can kind of cut the transmission chain, what we call a transmission chain. So it's really, contact tracing is not something that happens in a void. It's really part of a continuum, going from the early, quick detection of the cases, treatment, of course, and isolation of the patients, but as well doing this contact tracing and quarantine and trying to stop the ongoing transmission of the disease.
So this is something you mentioned, it's been around for a while. It's not new to the COVID-19 pandemic specifically. So we're hearing about it now, but this would be something that with other communicable diseases, countries have been implementing in order to stop transmission. I wonder if, perhaps someone from the Ministry of Health could tell us a little bit about why it's so important, both from, an individual point of view and also when it comes to the community.
Yes, so contact tracing is extremely important, particularly here in the Bahamas, where we have an archipelago of islands where there's a culture of inter-island travel. If you have one island that's untouched, contact tracing is important so that if someone is in say Nassau, the capital, and has been exposed, you want to tell them and notify them as soon as possible so that they don't then expose not only people in New Providence, their family, but then say travel to another island and do the same thing. And so, yes, it's extremely important here, particularly with our structure.
And when it comes to making policy decisions, where does contact tracing fit into that as well? Why is it important for policy specifically?
So really with policy making, we are, because we are so widespread, it is so important to make sure everyone is on the same page. When it comes to contact tracing, the whole mechanism is to monitor and also to understand transmissibility, what the virus is doing, where the clusters are. And you can't know that without contact tracing. You can't implement lockdowns without contact tracing to know where should you be locking down, things like that. And particularly with testing as well, what populations are we going to test? We don't know unless we know who is being exposed.
And if I may complement what Dr. Woodside just said, is as well that it's part of what we do in terms of investigation and in terms of describing what's going on as well. So every bit of information that you can really collect, especially as an outbreak or a pandemic like this is ongoing, can give you a clue, in terms of what you need to do. For instance, who are the persons that are more at risk? What can be the transmission as well within a household, and all these different parts that are essentially part of an investigation. And again, maybe we have always these ideas that we need to focus only on the patient, on the people sick, but it's somehow a way as well. Of course, the main principle is to interrupt the transmission, as I said, and that's why it is as well important that we can include as many as contacts as possible, but as well on a timely fashion, really, that we can really include people right after, they are exposed in this sense. But as well, it's part of the understanding on what's going on, and as well, the part of being able to collect the good data. So it's an integral part of not just identifying someone and putting them into contact tracing, into quarantine, but as well, it's a part that we really need to have quite a bit of work of working with the people as well on the quarantine in terms to make sure that they're really following up on what they are supposed to do, and as well to give feedback and tell if something is not going well. So it's important that it's done by the public health authorities, but it needs as well to have a lot of as well buy-in, if you want, by the people who are possibly contacted in quarantine, but as well more broadly, really, the community.
Brilliant. Thank you, Andrea. So just to remind everyone, we're here talking about contact tracing in the context of the COVID-19 pandemic. If you have any questions throughout the course of the next half an hour to 40 minutes, please put them in the comments section and we will ask the experts. So we've spoken a lot about what exactly is contact tracing and why it's so important in halting transmission of a communicable disease, in this case, COVID-19. But how difficult is it to actually implement a contact tracing system, particularly when we're dealing with, a global pandemic? And we know, of course, that the Bahamas, like the vast majority of the region of the Americas, has been hit by COVID-19. So I wonder if, perhaps Nurse Ernestine or Nurse Chesmond, you could tell us a little bit about the system that you've implemented in order to carry out contact tracing in the Bahamas.
So certainly we have a very robust contact tracing team. From COVID-19 was discovered in Wuhan, plans were implemented to get a contact tracing team prepared, to have them educated and brought up to speed. So in the implementation stage, the team was prepared, they were educated, so that when we do have our first case, that we would be prepared and ready to go. We would know what to do and we would know what to tell the public, because education is a very important aspect of contact tracing. So our team initially was just comprised of nurses, but it evolved into volunteers from all aspects of society.
Can you tell us what that actually consists of step by step? So let's assume, for example, that I'm in the Bahamas and I start to have some symptoms of COVID-19, and I go and get my PCR test and I test positive. Then what happens?
So
what happens is, the way it begins is when we receive a positive result from the lab, the contact tracing itself begins. The first thing is the person who has tested positive. The person who has tested positive is asked to list those persons whom he or she would have had close contact with. And we try to explain to them what close contact means in this case. We refer to those persons who would have been less than 6 feet, usually for more than 15 minutes at a time. And so the case will list those persons who fit into that category. The second step is we will notify those persons who've been listed, letting them know that they have been listed as contacts of the case. And then we conduct the monitoring phase where those persons who have been listed are monitored and assessed on a daily basis for 14 days.
Brilliant. And Dr. Blair, let's say, for example, that I've tested positive for COVID-19. I'm in the Bahamas. I know, of course, the family and friends that I've been in contact with over the past couple of weeks, but let's assume, you know, I went out to a supermarket or I went to a restaurant or another shop, if there's anywhere open. In that case, what would happen?
In those cases, we do, if the person recalls, we do try to notify the businesses. Usually they go through a process of high cleaning, depending on the information that the case gives us. It really all depends, and it's very case by case. In some instances where people have gone to the food store or the bank, we really haven't been able to say, you need to clean your institution, or you need to maybe test your employers. We haven't been doing that, but we do try as best as possible to notify the different institutions or different places, restaurants that person has been to.
And Andrea, what are PAHO's recommendations for implementing contact tracing? Because I'm assuming that, you know, maybe at a country level, that there's some countries with more experience than others at implementing certain systems, but I'm assuming, and correct me if I'm wrong, this is probably one of the first times that we've had, you know, an entire world basically that's had to suddenly implement these systems. So what are the basic steps that we're asking countries to follow to ensure that all of these potential cases of COVID-19 are picked up before transmission expands even further?
As I said initially, I think it's really something that we have been doing as epidemiologists forever, in a sense, for different type of diseases. You know what we are talking about, the follow-up of an importation of a measles case from the Europe, from another region to the Caribbean. You know, there's always been this type of work done, and maybe it was not as clear, you know, to the public in that sense, no? But I guess, you know, it is really part of this COVID-19, as I said, and probably as well, something that is difficult and more challenging is really the scopes that it needs to be. And it is really dependent on how much transmission is ongoing, okay? And that's, I think it's really the challenge for different countries, really, is that if there is very limited transmission, you know, what we call in terms of very localized or very cluster transmission still in cluster, it is perhaps easier to do. What is really challenging is when you have what is widespread community transmission. We have not really seen much in the Caribbean in that sense, but in many other countries, really, once you have what is called community transmission, that by definition is when you can no longer track this chain of transmission. You can no longer track exactly, who infected me, who I'm going to infect. That becomes really difficult to do contact tracing. And so I think it's really depending a lot in terms, we can always try to do it, and we should always try to do it. But it's clear that depending on the epidemiological situation, it can be sometimes more difficult than other one. But really, it's different, I guess, from the past. Is really two things, I guess. One is really the need really to involve the community. That in so many aspects, of what we deal with COVID-19 is really that the community, the public is informed in why and what we are going to do, and so that they can as well be very much part of it. And the second part, as I said, is really that it needs to be done on a scope that is much larger than before. So in terms of the health sector, that it means as well that in terms of planning, as well of the personnel that we need to involve, is much more complex than before. And so it means as well that we need to create alliances with other organizations and entities as well to be able to do this, when really the transmission is quite high in that sense.
Right. And you mentioned community buy-in as being quite an important factor. And I wondered, Dr. Blair or Nurse Chesmond or Nurse Ernestine, if you could tell us a little bit about how you've managed to achieve that in the Bahamas, or challenges that you've had ensuring community buy-in when it comes to implementing your contact tracing plan.
So there's a education campaign, a public health education campaign, where we have health experts on the news, on the radio shows, basically flooding the media outlets, talking about COVID-19, the severity of it, the importance of adhering to all safety protocols. I know our Ministry of Health, early on in the first wave, we had weekly health briefings by the Minister of Health and the health officials. So everyone was taking note of what was happening, not just in the Bahamas, but also globally. So what was happening in the United States and other parts of the world also helped us to achieve somewhat of the public buy-in.
And do you think that you have achieved public buy-in? Do you think that there's still some members who are a bit more skeptical?
So there is some more work to be done. We have challenges where some individuals, unfortunately, do not comply with the health and safety protocols.
Sorry to interrupt you, Nurse Chesmond. I think, Nurse Ernestine, would you mind muting while Nurse Chesmond is... There we go. Okay.
Sorry about that. So we have some challenges. We do have some challenges. Unfortunately, some individuals do not adhere to the health and safety protocols for whatever reason. We have put measures in place to help curb that. So individuals who need to go to quarantine, for instance, if they don't have adequate housing to quarantine, we have government facilities that they can quarantine in. If they don't have adequate food for the 14 days or adequate medication to manage their CNCDs, we provide that. So we are doing a lot to mitigate those factors also.
Brilliant. And when it comes, Andrea, and perhaps Dr. Blair as well, to the role of technology in contact tracing, I know that at PAHO WHO, we've been looking at Go Data. What other applications are there, and what role do these applications play? So, I know, for example, I have a friend in Argentina who had to download a mobile application. I was prompted in DC the other day to download something so that they could let me know if I'd come into contact with someone who tested positive for COVID-19. What's the role, and why is that so important?
If I may start, I guess, and Dr. Woodside can certainly complement a little bit more in practical terms as well with the Bahamian experience. generally, we have three types of tools, if you want, of innovation, in that sense. One is really what you can do in terms of really managing all the information. And you mentioned GoData. GoData is essentially really a tool really to manage really all the information that you need to have on the contacts, and especially on the follow-up that you need to do every day. And it can complement as well very well with what we call the surveillance system as well, in terms of that. There is a second area, if you want, that are what you mentioned in terms of these proximity type of tools, that really kind of sort of detect your vicinity, you haven't been in contact with someone who later really get confirmed. And that is a little bit different because it's really not so much nominal. You are not really identifying people in a sense, but it's just something that you get. And I would say that is definitely a path that has received more publicity in a sense, but it's not necessarily something that solves the issue, okay? Because it's just a tool, if you want. It's an innovation, can be important, but you still need to have that type of shoe-leather a type of approach of really going and actually finding out people and trying really to follow up as well. So it can be important in some places, but it's not really the solution. And the third set, of innovation, more like this application, is for people to understand, whether they are infected or not. That is really a little bit more broader and less developed, and probably not as important, as really following the instructions that they receive by their own health authority in terms, if I identify these symptoms, what I'm supposed to do. And so I think it's always very important to define all these different applications and all this innovation in terms of these three big chapters, if you want, of what we can do. And definitely, I guess, the colleagues, Dr. Woodside, maybe you can say, what they've done specifically in the Bahamas.
Thank you. So actually, technology was a very new thing for us. We started with a paper-based system, particularly for data management. And we realized that we had a surge in cases when we opened the borders. So we understood that we needed to have a data management or a way to collect the data in a quick way. We needed it very quickly, and we were doing some things with GoData to collect that data, but because we had so many people from different islands, the training process would have been a little bit too much. So we actually started to do something called SharePoint, which is I call it a repository, where people, multi-user platform where nurses, volunteers, and doctors around the islands actually are able to put in their information about their cases and contacts. And it's live. We can all see what's going on. We do use GoData, but more for data analysis for our chains of transmission. And we very well could transfer to that at some point with the data that we do have from SharePoint. And then for the monitoring system, similar to what Andrea was speaking about, is really what we use is something called Hubcat. And that's really just a proximity to ensure that people are adhering to the quarantine protocols. It's actually being taken, I guess, control of by national security now, because we were having a bit of issues with enforcement. So those are the two main, three main technological applications that we're using right now.
And you mentioned quarantine and enforcing quarantine and aspects of contact tracing like that, Dr. Woodside. But I wondered, perhaps Ernestine, can you talk me through a little bit about what would happen or what I need to do as an individual if I'm found to have been in contact with someone who's tested positive for COVID-19? What are the steps?
So persons are informed and told to self-quarantine and isolate once they have been told or they find out that they have been tested positive for COVID-19, or if they've been in contact with someone who tested positive. They are encouraged to do so. We are supported by law in the Health Services Act, where the government, the Ministry of Health, and the Chief Medical Officer have the authority to implement any protocol or procedures to encourage quarantine. So persons are educated on that, and so they know that they are mandated by law to remain in quarantine. Mr. Finley mentioned earlier about ensuring that persons have medication. One of the things we sought to do is to cater to the whole man, and persons are told about this as well. We try to develop a support system of persons, including spiritual leaders and psychological leaders, to provide support to persons once they are placed in quarantine or isolation.
Thank you. And Nurse Chesmond, let's assume that I've been within the 6 feet of someone who's tested positive for COVID-19, but I don't have any symptoms myself. Do I need to be tested? Do I acquire a test? What happens? Do I still really need to pay that much attention to the quarantine?
So with our system here in the Bahamas, you would be contacted daily by one of the health officials from the Ministry of Health. And once you inform the nurse or the contact tracer that you're beginning to experience symptoms, you'll be evaluated by a doctor over a telephone call. And based on the conversation you have with the physician, a determination will be made on whether or not you will be tested. And if a decision is made for you to be tested, the healthcare team will come to your home in a very discreet way and do the testing in your privacy of your home.
Brilliant. Okay.
If I may, Ashley, you mentioned it, the 2 meters, the 6 feet, okay, that is one element how to define contact. The other important is as well the time, the duration, that you can be exposed. So it's important as well, not just because, you have passed by someone somewhere, that necessarily you are at risk in that sense. So it's always very important as well that we are aware that there are some conditions that can be much more risky than other one, no? And we have talked about the 3 C's many times, the close contact, definitely, that is really especially in a close range conversation for a duration of period as well. The issue of the crowded spaces that are as well very important as well. If I'm in a crowded space with a lot of people, and as well what is the closed spaces with the poor ventilation, And so my risk really of being in contact and then, and really potentially being exposed and then develop an infection is really when I have these 3 conditions, especially if they are together, okay? And so it's important as well that a contact is really somewhat defined as well in terms of proximity, yes, but as well in terms of time. And especially, and then there are as well some conditions, as I said, these 3 C's that can as well determine, your risk really to being exposed.
And is that something which, when countries are implementing their contact tracing systems, that's taken into account when the contact tracing is taking place? So for example, I might have passed someone in a supermarket aisle, but of course there's going to be a huge difference in my risk of transmission between that and, I've sat down at a table and had a conversation. And is that taken into consideration, or is it not really? Because then I guess that sort of puts into question some of these applications that you mentioned, that it's just like I might have walked past someone who's tested positive for COVID-19.
Definitely. I mean, it is something that is very much part of this idea of contact tracing, where you have a definition of what a contact is, okay? It's part of the definition of what a contact is. So I just wanted to highlight really, it's not just the fact that you are in terms of distance, but as well in terms of time as well. And especially definitely, it can be as well evaluated with other risk factors that I mentioned, these specific circumstances that you have. But definitely, I'm sure that the colleagues as well, they have something to add on this one.
Well, I think Nurse Flowers actually mentioned it. We usually have a standard time of about 15 minutes. We say 15 minutes with less than 6 feet. And obviously in combination with just understanding the context, where were you? Are you in the same household? We try to dig in deep with the cases to understand to what degree are you at risk. And even those persons that are at lower risk, we still, in some instances, end up monitoring them, depending on if they're symptomatic or, some other confounding factors that may make us want to continue to monitor them.
Brilliant, thank you. If anyone has any questions about contact tracing in the context of the COVID-19 pandemic, we have about another 15 minutes left, so feel free to put them in the comments section and we'll get to them as soon as we possibly can. Let's get a little technical for a minute. So when I was reading up about contact tracing in preparation to ask the expert, because I'm always the least expert in these groups, I was reading about forward contact tracing versus backward contact tracing. I wonder if someone could talk me a little bit about what the difference is and what one we need to be doing, or whether we need to be doing both.
I may probably start, and then the colleagues, if they want to add something, they're welcome. This idea of backwards or forward contact tracing, first of all, what means forward? Essentially, I start always with my case, my patient, and I ask that patient exactly what are the contacts he may have or she may have, and you start by this list of things. But backwards contact tracing is really going back and trying to find out where I was really exposed, okay? And the idea is basically you go back and you try to find who was the case that exposed you, and you try to find out the contact of that person as well. So obviously this imply a lot more work, because you are not just following my 10, 12 contacts, but I'm really going back to find the 11 other people that were exposed with me. And of course, if you do the maths, it's 11 by 11. I mean, it becomes very quickly quite a bit. The idea really of including backwards contact tracing comes really from what they've done in Japan in particular. And as well on another idea, and again, I'm thankful that you said that we are going to be technical, because it is a little bit a technical issue.
A little technical, Andrea, a little technical.
It is with this idea of super spreading, okay? The idea that essentially the observation that 20% of the cases are actually causing 80% of the next generation of cases, okay? Most of the cases don't really cause any other secondary case, but a few of them, 10-20% cause most of them. So from a mathematical point of view, if you want, I'm more likely to be the consequence of a super spreading event than being myself a super spreading event, which means, it may make more sense that I go back and try to find my super spreading event than really following my contacts that may not actually be cases in the end. No? So it's a little bit a complicated discussion, but it's something that is very much on the table nowadays in terms especially of this experience from Japan, whether it is worth doing or not. But as I said, the big challenge is it is already enough complicated of doing the forward contact tracing than doing the forward plus the backwards contact tracing. It can really be quite challenging from an operational point of view. And I guess nobody really would have the courage of just doing backward tracing, contact tracing, because it would be really kind of difficult, to think only doing that in a sense and avoiding really going to forward contact tracing. complicated. I hope I was able to explain it to some extent.
Well, now I have some more questions. So you mentioned super spreaders, and that's definitely something that's been in the media quite a bit. And I guess from my interpretation of what you say, contact tracing, by implementing contact tracing, countries are much more likely to be able to identify these super spreaders and ensure that, you know, people are in quarantine before the super spread can, you know, super spread as much as it could potentially be. But what does it take to be a super spread? What's the difference between, you know, a super spreader and someone who has been in contact with someone else for, you know, 15 minutes within however many feet, 6 feet of distance, having a conversation in a restaurant?
I like always to talk about super spreading events and not super spreaders, okay? I think it's really this idea of having the 3 C's in particular, as that we were talking before, no? Close contact, crowd spaces, and as well close spaces, crowded places, and close contact. You know, that is really important, more than really saying that a person somehow, you know, it's spreading more, because it's not that really. It's really the idea of super spreading events, you know, that is important more than anything else. But the point is that you cannot really know it beforehand, okay, except for this combination of factors that may be more likely. But really, you can never know exactly when it's going to be the super spreading events, okay? And that's why really the importance of contact tracing is definitely that we can reach a good coverage in terms of people that we are including, in terms of contacts that we are including, but as well the timeliness how we are doing this, because it's as important as the coverage that we do. If you put people in quarantine, which is too late, it doesn't really serve much. And so there are as well these different parts, you know, that are important.
So I'm assuming then that, you know, when we talk about these super spreading events, you know, we're talking about these weddings where, you know, 50 something people were acquired COVID and events more like that. I was wondering what the experience of the Bahamas contact tracing team has been in identifying these events which, you know, have led to the transmission or the potential transmission of many cases of COVID-19. Have you found that?
So most definitely. And I like that you called it events because at one point we were calling our healthcare providers super spreaders because we have many healthcare providers, nurses, doctors that work in multiple institutions. And we were seeing that, you know, there were 1 or 2 people that were linked to 2 or 3 different institutions, and there were people that were also getting it from this one person. But again, it's not the person, it's the event. It's that they are unaware that they have COVID, and so they interact. Definitely parties, funerals, and this is where policy comes in. We start restricting how many people are allowed at certain events and try to really enforce that you do not want to be in large crowds.
Thank you. So we've had a question come in, I think probably for either Nurse Chesmond or Nurse Ernestine or both. So in your experience of implementing contact tracing in the Bahamas, have people been fearful to come forward after they've been contacted by your team?
Yes, most certainly persons were fearful, and so they refused to continue to communicate with us when we make our calls. During our first call, we found that they spoke to us, they gave us the information that we needed. But when we tried to make subsequent calls, we realized that the call was either rejected or there was an excuse, can you call me back? Or a family member who should not actually have been in the same environment or the same room with the person would say that she's asleep, or they'd find an excuse for the person. So yes, we found that persons were fearful. And I think part of it, we noticed that some persons were afraid because of stigma. A certain level of stigma was placed on the disease. And so our calls were rejected at times.
Thank you. And Nurse Chesmond, I just have another question for you as well. So, you know, we know that with many aspects of the pandemic response, you know, countries have not been able to implement, for good reason, a one-size-fits-all approach. So when it comes to contact tracing in the Bahamas, have you noticed that things are having to be done differently, you know, from island to island, or whether you're working in a more rural area versus a more urban area? What kind of adaptations are your team having to make to ensure that no one gets left behind when carrying out contact tracing?
So certainly we have to make some adaptations. On some of our outer islands, the healthcare team would actually have to go to the home of the contact or the case to speak with them, to assess them on a daily basis. Sometimes here in New Providence, we have to send a healthcare team out to the home also. So it's a combination of the calls, in-person assessments, and a variety of different tools. We've started using technology a lot more. Dr. Woodside spoke to that. Sometimes we have to use WhatsApp video calls to help patients to actually assess some of their complaints. So we have used a multitude of adaptations to enhance our contact tracing.
Brilliant. And we have a question. I think it might be one for you, Andrea. So when we're talking about asymptomatic contacts, how infectious are they likely to be compared to people that have symptoms of COVID-19?
It's a good question, and I'm not sure we have a good answer to that. In a sense, I think it is always important to make the distinction between persons that are truly asymptomatic. It means that they will never really develop an illness, and people that are pre-symptomatic. It means that it's the short period of time before really they develop symptoms. Okay. And most of what we really call asymptomatic are actually pre-symptomatic people, okay? And that's why quarantine is so important, because it's really avoiding before you really develop a disease that you're already somewhat isolated already before developing the symptom. And that's really the importance of the quarantine, that since we cannot really know whether, you know, a person that has been exposed potentially is infected and potentially will develop the disease or may not, even if infected, it is really important, you know, that we can already limit, if you want, the possibility of spreading on the disease. And that's why really the importance of this. And again, as well, is the importance of why quarantine is as well, it implies as well taking some care of the people you are living with, okay? It's not only being limited in your household, but you have as well as to limit as well the contact with the people you are living. I know it's not always as easy, you know, especially if you don't have a separate room, if you don't have a separate way of, you know, of living in a sense. But it's as well an integral part of the quarantine. And by no means, I guess, you know, we say it's easy, okay? But it can really be important in terms of as a responsibility, social responsibility, but as well as responsibility, you know, with the people you are living with, and essentially with your family as well.
I think that was a really pertinent message. It brings me nicely into the final question, because we're getting to the end of this session of Ask the Expert. And that is, given that the vast majority of our audience listening today is from the general public, probably not healthcare professionals, and given that we rely so much on the general public in order to effectively implement contact tracing, what would be, and I'm going to ask this for each of you, the main message that you have to give to the public to ensure that countries can effectively carry out contact tracing and halt transmission of COVID-19? Should we start with Dr. Woodside?
Well, my main message would be, if you are a person that is getting swabbed for whatever reason, you're having symptoms or you want to travel, to ensure that after you get swabbed, the day you get swabbed, you go home, because you are now a potential case, you're a suspected case, and you can expose people if you decide to then run errands that day. That day is the day that you are a suspected case, and you have to then quarantine yourself until you have your results. So that would be my message.
Dr. Chesmond, Nurse Chesmond, sorry.
My message would be that if you are contacted by the health team of the Ministry of Health, to be nice, to be forthcoming with information. We are all Bahamians. We rep the 242. We love Count Salad. We love everything that makes us truly Bahamian. And we are in this together as a nation. And we're going to come up through this together as a nation. So you're not alone if you're in quarantine or if you tested positive, you're not alone. We are there to help you. We are there to support you as best as we can. And all we ask is that you be forthcoming with information so that we can help you through this process.
Nurse Ernestine?
Yes, we would ask that they follow the orders that are given by the competent authority, remain socially distant, continue to wear masks, and remember to hand sanitize at all times.
Brilliant. And last but not least, Andrea, Dr. Vicari?
Yeah, thank you, Ashley. I don't know what else can I add, really. I think
It's been covered at this point.
Really, it's really definitely an important tool that we have, especially if we want to move away in terms of more broad social measures, in terms of closures, in terms of it's really kind of focusing in where the infection is and where the transmission is going on. So I think, it's as well a contribution that everyone can give in terms of really following the instruction of the health authority in that sense, and being part as well of this, because it can really speed up in terms of what we can do of COVID-19. And if I may, I would really like to thank the colleagues, who participated today, and really congratulate the colleagues and the health authorities and all the colleagues in the Bahamas as well, in the rest of the Caribbean, for the outstanding jobs that they have been doing during these really very difficult months as well throughout the region of the Caribbean. Thank you so much.
Thank you. And I'd like to echo that thanks. Thank you so much, Dr. Woodside, Nurse Finley, and Nurse Flowers. And of course, Dr. Vicari, for taking the time to speak to us today about COVID-19 and contact tracing in the context of the Bahamas. We will be back next week for a new session of Ask the Expert. So please join us then. Thank you very much and goodbye.
Thank you.